Given this day and age where we are constantly looking at screens, many of us suffer from the symptoms of dry eye. So what should we do in our day-to-day to prevent these symptoms? Hi, I'm Dr. Krishna Poojita from Pixel Eye Hospital. Today we're going to be discussing about the different causes of dry eye. So the most, there are different types of tears which are present in the eye. One is the water-based tears and another one is the oil-based tears. So water-based tears form the major bulk of the tear volume, and the deficiency of water-based tears is seen in systemic conditions like rheumatoid arthritis, which causes joint pains, or associated with dry mouth like Sjogren's syndrome or other autoimmune kind of disorders. Use of certain drugs like antidepressants, antipsychotics and certain type of antihypertensives and anti-glaucoma medications in the eye can also precipitate dry eye in some people. In addition to it, oil deficiency could be seen in a condition called as meibomian gland dysfunction, in which the oil producing glands which are there in the lid either are deficient or have degenerated, or despite being sufficient are not producing adequate amount of oil inside the tears, because of which the symptoms of dry eye appear. Prolonged use of contact lenses over many years, especially those who are high myopes, they find it more comfortable to use contact lenses. So prolonged use of contact lenses over many years can also lead to degeneration of the meibomian glands and hence cause dry eye. But one of the very common causes which we are seeing now because of certain gadgets and devices which are helping us diagnose is partial blinks. These are more common in people using the computer and screens for too long, and these blinks are so insufficient in the amplitude and also insufficient in the pressure that it creates inside the ocular system for even spread of the tears. So these are running through the most common causes. What should you do in your day-to-day to prevent the symptoms of dryness? So we cannot avoid certain conditions like rheumatoid or other systemic diseases, but the functional causes of dry eyes which are seen because of partial blinks are easily avoidable. So make sure when you're looking at the screen, you ensure that the screen is not located at a higher level or equal to the level of your eye. It should be slightly lower. Reduce the brightness of the screen. Normally, our blinks are somewhere around 12 to 15 per minute. When we are staring at a brighter screen, they come down very normally, naturally, even without you realizing, to about 5 to 6 per minute. And if those blinks during those times are not complete and are only partial, then whatever oil and tears that is produced also will not spread very well. So whenever you're looking at the screen, make sure you're blinking full and complete. Keep that at the back of your mind. Follow the 20-20 rule, which is every 20 minutes, take a break for 20 seconds, look at an object that is farther than 20 meters, and also ensure that you're giving your eyes a certain amount of rest by either closing them or doing some lid squeezing kind of exercises. Drink a lot of water. Avoid facing the AC blast or a fan blast right when you're looking at a screen. Reduce the brightness of your screen, and and use protective goggles or something whenever you're driving the motorbike or exposed to direct wind which is hitting your eyes.